अस्सलामुअलैकुम व्यूअर्स, वेलकम टू माय यूट्यूब चैनल। दोस्तों, उम्मीद करूँगी कि आप सब लोग खैर आफियत से हैं। आज की इस वीडियो में दोस्तों मैं आपको हेल्थ इंश्योरेंस के बारे में बताऊंगी। बहुत ही इंटरेस्टिंग वीडियो है दोस्तों, इस वीडियो को पूरा ज़रूर देखिएगा ताकि आप लोगों की इन्फॉर्मेशन में इजाफ़ा हो। और इस वीडियो को स्टार्ट करने से पहले मेरी आप लोगों से छोटी सी दरख्वास्त है, मेरे यूट्यूब चैनल को सब्सक्राइब कर लें, लाइक करें और कमेंट्स में ज़रूर बताएं कि मेरी वीडियो आप लोगों को कैसी लगी। तो चलिए आज की इस वीडियो को स्टार्ट करते हैं हेल्थ इंश्योरेंस के बारे में। फर्स्ट ऑफ ऑल वी सी अबाउट व्हाट इज़ हेल्थ इंश्योरेंस। हेल्थ इंश्योरेंस इज़ अ कॉन्ट्रैक्ट बिटवीन अ कंपनी एंड अ कस्टमर. The company agrees to pay all or some of the insured person's health care costs in the return for payment of a monthly premium. The contract is usually a one-year agreement during which the insurer will be responsible for paying specific expenses related to illness, injury, pregnancy, or preventive care. Health insurance agreements in the US generally come from exceptions to coverage, including a deductible that requires the consumer to pay certain health care costs out of pocket up to a maximum amount before the company coverage begins. One or more co-payments that require the consumer to pay a set share of the cost for specific services or procedures. Health insurance pays most medical and surgical expenses and preventative care costs incurred by the insured person in return for a monthly premium payment. Generally, the higher the monthly premium is, the lower the out-of-pocket costs are to be insured. Virtually all insurance plans have deductibles and co-pays, but these out-of-pocket expenses are now capped by federal law. Since 2010, the Affordable Care Act has prohibited insurance companies from denying coverage to patients with pre-existing conditions and has allowed children to remain on their parents' insurance plan until they reach the age of 26. Medicare, Medicaid, and the Children's Health Insurance Program are federal health insurance plans that extend coverage to older, disabled, and low-income people. How health insurance works. In the United States, health insurance is tricky to navigate. It is a business with a number of regional and national competitors whose coverage, pricing, and availability vary from state to state and even by country. About half of the population has health insurance coverage as an employment benefit, with premiums partially covered by the employer. The cost to employer is tax deductible to the payer, and the benefits to employee are tax free with certain exceptions for S corporation employees. Self-employed people, freelancers, and gig workers can buy insurance directly on their own. The Affordable Care Act of 2010, commonly called Obamacare, mandated and creation of a national database called healthcare.government, which allows individuals to search for standard plans from private insurers that are available where they live. The cost of coverage are subsidized for taxpayers whose incomes are between 100 plus and 400 percentage of the federal poverty threshold. Some, but not all, states created their own versions of healthcare government that are tailored to their residents. People over the age of 65 and those with disabilities and stage renal disease or qualify to receive the federal subsidized care through Medicare, while families whose incomes are near the poverty level आर एलिजिबल फॉर सब्सिडाइज्ड मेडिकेड कवरेज। तो दोस्तों उम्मीद करूँगी कि मेरी आज की वीडियो आप लोगों को पसंद आएगी। मेरे यूट्यूब चैनल को सब्सक्राइब कर लें ताकि हर आने वाली नई वीडियो आप लोगों तक बआसानी पहुंच सके। मिलते हैं अगली वीडियो में, तब तक के लिए अल्लाह हाफिज़।